Hi, I'm Dr. Justin Easow, consultant endocrinologist at the Tiruvalla Medical Mission Hospital and at Believers Church Medical College Hospital. So we keep hearing a lot about fatty liver. One of our relatives or our friends or someone known to us might have done an ultrasound scan of the abdomen for some reason, and the report might show grade 1 or grade 2 fatty liver disease. And sometimes we wonder what needs to be done for it. Now, so what exactly is fatty liver? The liver is a big organ in the upper right side of the abdomen. A healthy liver contains no more than 5% of fat. And so, as the name implies, it is a condition in which there is accumulation and buildup of fat in the liver. Now, previously it was thought that only those who drank too much alcohol could develop fatty liver. But now we know that there are so many different reasons why fat can get deposited in the liver. And so fatty liver that is caused due to reasons other than alcohol is known as non-alcoholic fatty liver disease. Now this could be of two types. Number one, it could be non-alcoholic fatty liver in which there is just fat accumulation in the cells of the liver. And second, it could be non-alcoholic steatohepatitis or NASH. Now this is the most serious form in which there is not just fat accumulation in the cells of the liver, there is inflammation, there is damage to the liver cells, there is scarring and fibrosis of the cells of the liver. Now this is not an uncommon condition. The global prevalence is around 25%. And in India it varies from around about 9 to 53% depending upon the studies that has been done. So why is non-alcoholic fatty liver disease important? One, those with non-alcoholic fatty liver disease have 2 times increased risk of developing type 2 diabetes mellitus. And not just that, those with NFLD are also more prone to develop the complications of diabetes like eye disease or kidney disease or damage to the nerves or even cardiovascular disease. Second, approximately 20% of those with NASH go on to developing significant liver disease like cirrhosis. And third, NASH remains one of the top most causes of liver cancer. But in spite of this, in spite of the reason that this condition causes many serious complications, less than 5% of those with NAFLD are aware of the disease. And so it is important to increase the awareness. So how do you know if you have non-alcoholic fatty liver disease? Now in most cases there are no symptoms. Some people may have a generalized sense of fatigue, or some people may even have a vague discomfort in the right upper side of the abdomen. If you do a blood test like liver function test, the liver enzymes like SGOT and SGPT may be elevated. If you do imaging like ultrasound or CT or MRI, the liver may show fat accumulation. You could also do a fibroscan to determine how stiff the liver is. And also the final confirmation, however, is by doing what is known as a liver biopsy. So how do you treat fatty liver disease? Now there is no known cure for non-alcoholic steatohepatitis. The treatment mainly focuses on treating the associated medical conditions, which are 1. Obesity. 70% of people with NASH are obese. They can have associated insulin resistance or metabolic syndrome. Now insulin resistance is a state in which the patient does not adequately respond to insulin but has not developed type 2 diabetes mellitus yet. Now the treatment here is weight loss, at least 5% weight loss or preferably 10% weight loss can change the histology of the liver. It can decrease the fat buildup in the liver. Now this can happen by a combination of regular exercise of at least 60 minutes a day and by bringing about a change in your diet. Decrease the amount of carbohydrates and include adequate vegetables and fruits. decrease the intake of oily foods, sweets, junk foods, and refined foods. The second condition is type 2 diabetes mellitus. Up to 75% of those with NASH has type 2 diabetes mellitus. So if you're someone who has got diabetes and if your blood glucose levels are uncontrolled, then this can be a major reason why NASH could progress and lead to significant liver disease. So it is important to keep your blood glucose levels under control by bringing your HbA1c to less than 7% or preferably to less than 6.5%. Now, certain kinds of diabetes medications could be preferred in those with NASH, about which you could discuss with your doctor. And the third condition is hyperlipidemia. About 20 to 80% of those with NASH have increased triglyceride levels or increased blood cholesterol levels. The treatment here again is lifestyle modification, and if required, if the doctor decides, you also may need to be put on medications for high cholesterol levels. And the fourth condition is hypertension. If you have uncontrolled blood pressure levels, you need to bring them into control. If you're someone who consumes alcohol, then you need to stop consuming alcohol. And vitamin E could also be helpful in those who have NASH without type 2 diabetes mellitus. So if you're someone who has got these associated medical conditions, you need to check with your doctor, get screened for fatty liver, because like I said, many a times it is asymptomatic, and not diagnosing and treating it at the right time may lead to serious complications. Thank you.